What is cervical cancer? Cervical cancer is cancer at the entrance of the uterus, or more commonly referred to as the cervix. The cervix is located at the lowest-most part of the uterus, where it connects with the vaginal wall. The prevalence of cervical cancer. Every 2 minutes, one woman dies from cervical cancer. In North America, 17.2% of women suffer from cervical cancer. In South America, 14.3% of women suffer from cervical cancer. In Europe, 6.6% of women suffer from cervical cancer. In Asia, 8.3% of women suffer from cervical cancer. In Africa, 22.9% of women suffer from cervical cancer. That is approximately 1 in every 5 women. So, what is the main cause of cervical cancer? Cervical cancer is caused by human papilloma virus, or HPV. There are more than 100 different types of HPV. However, not all strains cause cervical cancer. HPV type 16 and 18 are oncogenic and cause cervical cancer, whereas HPV 6 and 11 are non-oncogenic and these types cause genital warts. The risk factors for cervical cancer. Smoking is a risk factor for cervical cancer. Dangerous components from cigarette smoke is absorbed through the lungs and distributed to the whole body. Nicotine is found in the mucus of the cervix within smoking women. Researchers believe that this component destroys the DNA of cervical cells and contributes to the development of cervical cancer. Smoking also lowers the body's immune system, thus making it harder to prevail against HPV infections. Women who smoke have twice the likelihood of suffering from cervical cancer compared to non-smoking women. Oral contraceptive pills. New research shows that risk of cervical cancer doubles in women who consume contraceptive pills for more than 5 years. Synthetic progesterone used in the oral contraception pills has been shown in medical research to promote certain cancers. Multiple sexual partners. Having multiple sexual partners increases the risk of cervical cancer. Research shows that the etiology of cervical cancer is also another risk factor, such as if the spouse seeks prostitutes, this could be a source of cancer to the wife. Obesity. Family history. Having a blood relative with a history of cancer increases the risk of cervical cancer. HPV infection, a preventable cause of cervical cancer. Cervical cancer symptoms. The presentation of cervical cancer symptoms vary by stage. In the early stage, symptoms are more often than not absent. At the middle stage, symptoms that may present includes abnormal bleeding. This must be distinguished from that brought upon by menstruation or sexual intercourse. This may be accompanied by pain in the pelvis as an indicator of cervical cancer. Leukorrhea, which is a whitish or yellowish discharge of mucus from the vagina, often occurs in large quantities and is very intrusive. It may be accompanied by blood. Lastly, unreasonable amounts of pain during sexual intercourse is also a main symptom of cervical cancer. Symptoms that often manifest during the late stage include pain in the back, lack of appetite, pain in the pelvis, weight loss, urine and feces escapes via vagina. Late stage of cervical cancer is extremely dangerous and professional medical care must be consulted with haste. After cervical cancer has been diagnosed, tests are done to find out if cancer cells have spread within the cervix or to other parts of the body. The following stages are used for cervical cancer. Carcinoma in situ, stage 0. Abnormal cells are found in the lining of the cervix. Stage 1A. A very small amount of cancer that can only be seen with a microscope and is found in the tissue of the cervix. In stage 1B2, the cancer can be seen without a microscope and is more than 4 centimeters. Stage 2. Disease progresses beyond the cervix. Stage 3. Cancerous cells have grown to pelvic wall or lower 1/3 of vagina. Stage 4. Invades the bladder, rectum or metastasis occurs. Cancer can spread through the lymph system and the blood to other parts of the body, such as the liver, lungs, bones, or distant lymph nodes. There are different types of treatments for patients with cervical cancer. 4 types of standard treatments are used: surgery and radiation therapy, chemotherapy and targeted therapy. However, follow-up tests may be needed. % of cervical cancer caused by HPV can be prevented by vaccine. Vaccination will stimulate serum antibody. Antibody will neutralize the virus and prevent HPV from infecting the cells. The side effects of vaccination are minimal. First, the site of injection turns reddish, then dizziness occurs, and lastly, fever. Control after vaccination is important. Although vaccination has been obtained, routine screening is essential. The vaccination only decreases the risk of cervical cancer from 70 to 80%. HPV vaccines shouldn't be administered when someone has experienced severe allergic reaction to HPV or its components, or people who have severe allergies to anything including baker's yeast and latex, or people with bleeding disorder, pregnant women, and people above the age group of 26. Cervical cancer can be detected by screening known as the Pap test or Pap smear. The main purpose of this screening is to detect abnormal cells that may develop into cancer if left untreated. While a woman lies on an examination table, a healthcare professional inserts an instrument called a speculum into her vagina to widen it so that the upper portion of the vagina and the cervix can be seen. This procedure also allows the healthcare professional to take a sample of cervical cells. The cells are taken with a wooden or plastic scraper or a cervical brush and then placed on a glass microscope slide, and a fixative is added. Next, the slide is sent to a laboratory for analysis under the microscope. When should a woman begin cervical cancer screening, and how often should she be screened? Cervical cancer is 100% curable if detected early. The sooner, the better.